Hi, this is Julie Levinsky. I'm the web manager for the Christopher and Dana Reeve Foundation, and I'd like to welcome you all to this month's edition of Chatting Live with Nurse Linda. I want to tell you about Linda. She is a leader, teacher, and provider of rehabilitation nursing for over 30 years. And she also worked very closely with Christopher Reeve on his recovery and has been advocating for the Reeve Foundation ever since. And we're so happy to have her here live answering your questions. And so I am going to now shoot it over to Linda. Hello, Linda.
Hello, and hello to everyone. It's in my area where I live, it's in the Midwest, and we had a big blast of snow last night, which for us was a lot of snow, but I know there are other parts of the country that have been hit much, much worse. But it's just kind of interesting to note different parts of the country. Some people get a lot of snow and they just pick up and keep going. And where I live, it's like we got just a couple inches of snow and we're kind of all shut down because we just don't accommodate for that here, I guess. So it's just kind of funny. But it makes me think of being cooped up. I'm in my office, which is lovely, has some lovely warm heat in it today. And I'm really happy for that because we've got a big blast of cold air outside. But it made me think about our topic today, and that breathing and that exchanging that oxygen and carbon dioxide is just so important to our well-being and what we can do. And a lot of times we don't sit and think about breathing because breathing is a natural phenomenon. It happens through the autonomic nervous system, and as you know, I like to call that the automatic nervous system because breathing is just something that happens in our body. We don't have to think about, take a breath in, let a breath out, and yet breathing is one of the more interesting systems because even though it's from the autonomic nervous system, we can also control it if we want. So we can hold our breath for a little while. We can take in a deep breath. We can cough. So there are things that we can do to our body to affect our breathing, but it's going to happen automatically whether we're thinking about it or not. So it's kind of a dual system. Unlike things like your heart beating, your heart's automatic. It's going to beat. It's not going to stop. You can't control it. You can't speed it up. You can't slow it down. So breathing is kind of a little bit unique in that way that we can control it if we choose to. And so keeping our respiratory system clear is going to help us really feel better, going to be able to get more oxygen into our system, and so we're going to be able to do more things, but we don't often think about it because it's just something that naturally happens. Of course, if something goes wrong with our breathing, it is a big panic, of course, for everyone. So we'll get into talking a little bit more about breathing as we go along, but we have a question from Jenny, who's a follower, which we appreciate all of our people that read and write in. And Jenny's sister has MS, and she lives in the UK, so it's very late for them over there. So we really appreciate Jenny staying up to find out. She's a great advocate for her sister. And so the sister's having some numbness and tingling in her arms and hands, and they're very worried about that. Could that be a progression of her MS? And so they don't want this, progression to happen. Well, so what is the answer? Well, yes and no. So numbness and tingling in the hands and fingers can be from a whole variety of issues. And it's not uncommon in a variety of diseases. It's just one of those things that happen. Does numbness and tingling happen to be a sign of progression with MS? It can be an indication, but it doesn't necessarily mean that it necessarily is, especially when you have diseases like MS or other diseases of your body that kind of affect the way that you move and the way your body metabolizes things. Sometimes you can get numbness and tingling in your hands just from poor positioning. Now, I have the feeling that Jenny and her sister are very on top of positioning in her wheelchair, but maybe with some changes in her disease process or in her body functions, maybe her positioning has become affected, that her arms are not being supported or being positioned in such a way that some of the circulation is not freely going through to the hands and fingers. Another big diagnosis that affects numbness and tingling in the hands and fingers and the feet and toes is diabetes. So that is something you might want to check. With some of the MS medications, you can tend to run a higher blood sugar, or just with inactivity you can tend to get a higher blood sugar. And so that is something that can be maybe not with the diagnosis of diabetes, but with just running a higher blood sugar as your body is accommodating and trying to accommodate for the disease process. Another thing that causes numbness and tingling, which is, these are really common things. So, if you think about, you sit funny or you lay on your side and you wake up and you think, oh, my hand's asleep, it's got numbness and tingling, and so you move it around and shake it out a bit, and it seems like it, just goes away. It's not a long-term thing. But sometimes when we lay on our side or when we're positioned a certain way, the nerves in our peripheral nervous system can become affected. And people don't often think about this because it's one of those things that, we're just so readily to shake these things off. But the peripheral nerves are all the nerves outside of the brain and spinal cord. So the brain and spinal cord are the central nerves, and then all the other nerves in the body are peripheral nerves. And sometimes when we lay on our hands, or if you're bending your wrist to help push yourself up and you're extending your wrist a little bit too much or putting too much pressure through the wrist joints, sometimes those nerves can get overstretched, those peripheral nerves. Now we're all familiar with carpal tunnel syndrome, where the median and ulnar nerve runs through that little tunnel of ligaments right at the inside of the wrist. If you're looking at your palm and you look right where your your palm meets your arm, that's right in the center there is a little tunnel, and those two main nerves run through there to control your hand. So the median nerve controls your thumb, your pointer finger, and your middle finger. And then the ulnar nerve affects your pinky and your ring finger. Now the middle finger has a little bit of the ulnar nerve going through on the one side too, but it's mostly run by the median nerve, so we group it over there. So sometimes people will say, I have numbness and tingling in my ring and pinky finger, and we know that that's a problem with the ulnar nerve. And if it's in your thumb or your pointer or your tall finger, then we know it's a problem with the median nerve. But if you have numbness and tingling in your whole hand, it could be an entrapment there at your wrist. And it's not uncommon for people who have disability to be putting weight on their hands while they're trying to lift their body to transfer and stretching that nerve through the tunnel there at the wrist. There's also a tunnel that goes in through the elbow, and that one's called the Cubital Tunnel. So the carpal tunnel's at the wrist, and that one we hear a lot about. And the Cubital Tunnel is at the elbow, and so you can get some entrapment there. There's little nerve entrapment places all throughout our bodies, which we don't really even know that they're even there except for when we have problems. So with numbness and tingling in the arms and fingers, could be a consequence of positioning, could be a consequence of using your upper extremities to carry the weight of your whole body while you're trying to walk with crutches or a walker, or it could be a consequence of transferring and putting too much weight through those parts of the body. So it could be a signal that maybe it's time to get some different adaptive equipment to help move from spot to spot. Or maybe you're laying on your side at night and your body weight is being placed on your arm, and that's cutting off some of the circulation which is feeding that nerve. So it's the same kind of process with nerve entrapment. Another diagnostic category, something like diabetes, could be affecting it. Could it be an expansion of the MS, and it possibly could be. The thing about our nervous system is that it gives us lots of clues when something's wrong. It unfortunately doesn't tell us this is the problem, which would be wonderful if we would, because then we would just fix that problem as best we can. But so it could be a variety of things, because numbness and tingling just means that there's something that's bothering those nerves. And so the body wants us to do something about it. It could be that maybe with some exercise that might strengthen her arms enough that maybe that would be eliminated. So how can this be averted? Well, there are many medications for MS, and I'm sure that you're on top of these also. But there are many medications that seem to slow the progression of MS. So I have the feeling Jenny has got her sister on, discussed with their healthcare provider, and her sister's taking some of these medications. And so that is usually what we do. But, you know, don't overlook the more simple things too, because, you know, everybody gets numbness and tingling in their hands and fingers at some time. Some people talk on the phone, and when they do, they have their elbow on their table, or they're working on something and they're holding their head up and their elbow's on the table. And that pressure of that elbow is going right on the nerves that are going through that tunnel there. And when they move their elbow off the table and move their arm about, the numbness and tingling goes away. So in my response to you, Jenny, is gee, I hope it's not an advancement of her disease. But, you know, don't overlook the obvious also and get treatment. You know, just try different positioning. Look at positioning in her chair. As I recall, I think maybe she uses a wheelchair. And Jenny, I don't know why. I could be making that up about you, but it seems to me like maybe she's in a chair. And so look at the padding on the chair, the transfer techniques. Maybe it's time to use one of these transfer assist devices that maybe will help her. Some of them can be used independently. It's another piece of equipment. Maybe, you know, there might be other alternatives. Speak to your physical therapist. They might be able to help you with some weight-sparing techniques and different transfers that might help in energy conservation. So with MS, keeping your energy expenditure lower is a better thing, because it's much more exhausting to do things because it takes more energy. So anyway, I hope that that works out for you, and I'm glad that you are such an advocate for your sister, because, you know, we all need advocates for us in the healthcare system, because it's so very complicated, and navigating it is difficult, especially when, you know, you are the one who has some issue. It's kind of hard to take in all the information. So I wish you well on that, and please feel free to call in or write in whenever you have another issue. That would just be great. And yeah, we call it pins and needles in the United States too. So I think numbness and tingling would be the medical terms, but yes, pins and needles is what everybody calls it. So we'll just go with that. Let's see what else is going on. There's another question here, getting back into the respiratory system. And so Bernadette is writing in a question about a person with quadriplegia having a little cough reflex, and what can I do to clear my lungs? Well, there's lots of things that you can do. And, you know, again, you have to look at all the options that are available to you, and then discuss with your healthcare professional which would be the most appropriate option for you. Because whenever you do any kind of treatment, there are going to be benefits and there are going to be risks. So you need to look at what the appropriate treatment for you is. But with having little cough reflex and having problems clearing your lungs, there are some variety of things that you can do. Now, if it's an episodic moment that you're having trouble clearing your lungs, maybe you have a cold and you have some extra secretions in your lungs and you're having trouble getting those out, There are some drugs that you can take. One is Mucinex, which is over the counter. You want to look at the side effects. Talk with your healthcare professional, your pharmacist, make sure it doesn't interact with any other medications that you're taking. But this is a drug that's being prescribed a lot for people who are having trouble coughing because the medication brings out these secretions. And so it's very helpful, but you should only use it temporarily. It shouldn't be a day-to-day kind of situation. Now let's see. I just got a little box that said my program stopped working. So if there's an issue, I hope somebody calls me because I'm talking, but I don't know that you cannot hear me. So anyway, I'll keep talking and see what happens. I hear somebody. So
it's Julie. I just wanted to let you know that we can hear you fine. So
oh, good.
Keep going. You're good.
I thought, oh gosh, I'm just going to be talking here. Okay, so good. All right, I don't know what that little warning was, but we'll just move on. Okay, so Mucinex is one thing you can try. There are some other drugs that you can try that are prescription drugs that people take routinely to help bring up secretions. Now, if the drugs don't work for you, you don't want to take the drugs, what other kinds of things that can you do? There's some mechanical things that you can do. One is to have suctioning, and a lot of people find that maybe a little bit uncomfortable at the time it's being done, but on the other hand, it feels a lot better once all of those secretions are removed. If they're really thick and they're really hard to get out and you're having a struggle coughing, suctioning is probably the way to go. There is a cough or a sigh button if you have ventilatory dependence, if you're on a respirator. Those will help bring out some of the secretions also. Now there is another technique, and I'm going to be very cautious in bringing this up, but it's assisted coughing. And it's a mechanism where someone, an assistant, helps as a person attempts to cough. They put some pressure on their in the trunk of their body. So as they cough, somebody adds some outside pressure, and that creates a negative pressure in the abdomen, which helps bring up some secretions. I'm not going to talk about it a lot because if you're not properly trained in this technique, you can actually cause a lot of problems to the person. You can break their rib even, and there can be a lot of with breathing, you don't want to mess with the natural process too much. But I am going to tell you about it so that you can talk to your healthcare provider and get training with your assistant or family member, your caretaker, whoever you would like to help with the assistive coughing, and they can train you specifically on where to place your hands, specifically where not to place your hands, and so and how many times to do it, etc. So this is a mechanism that will help bring up some secretions. There are many videos that are available on YouTube that demonstrate this. Some are absolutely excellent. Some are maybe don't give quite the correct information. So you might want to educate yourself by looking at a few of those, but don't venture into this sort of thing without talking to your healthcare professional. There are some diagnoses that doing the assisted coughing will cause extremely more harm to the individual. So you really want to check with your healthcare professional to make sure that is the right thing for you. So I really want to stress that. Just don't look on the internet and start doing it. Make sure that your diagnosis, the situation that you have going on in your body, that it is appropriate for you to do that kind of training. So there's a variety of things you can do, from medications to suctioning to using the cough and sigh button on your ventilator to assisted coughing. So be very cautious with all of them because you don't want to do more harm than good. So let's see. Okay, so here is a great question from Steve. And I thank you for putting this in here because for those who've suffered a spinal cord injury, what level should we be concerned about breathing? This gentleman says he is T5 and he's had no issues. So who should be concerned about breathing with a spinal cord injury? Well, it doesn't matter if you have a spinal cord injury or not. Everybody should be concerned about their breathing. Now, at the lower levels of breathing at T5, if you think about where your level is, that's kind of like right in the middle of your torso. And so that is, your injury is below the area where the nerve is going to be affecting your diaphragm. But breathing is really consists of several different body processes at the same time. The phrenic nerve is controlling your diaphragm, which pulls up and down, which causes air to come in and out of your body. And that is the main source of breathing. But there are other assistive mechanisms that will help. And one is the muscles that are in between your ribs. There's some muscles that go in between every single rib that you have. So they're kind of tiny muscles in there, but they're called the intercostal muscles. And those muscles help expand and contract your rib cage. So if you're having if you have a T5 injury, you're kind of right in the middle of your torso, probably those intercostal muscles up in your rib cage are probably not affected. So you have your diaphragm and you have your intercostals, so you're doing really great. But there's a third set of muscles that are going to help with your breathing too, and that's in your abdomen. So people who have weak abdominal muscles need to spend a little bit more energy breathing because that third piece of the puzzle might be affected. So weak abdominal muscles can help. Now, probably at a T5, you're probably doing fine. You clearly state you've had no problems, but you do have one little piece of the puzzle that's missing. It's not really affecting you, and probably it won't affect you maybe until you have a cold or the flu, and then your other muscles, are looking for that little bit of extra support. With coughing, we use a lot of our abdominal muscles to help push up, to help our diaphragm push up a little bit more. And then also as you get older, having, if you think of a puzzle and you have all the pieces there, it all looks and works together pretty well. But if you have a little piece of it missing, you're kind of like, what's that piece missing up there in the corner? And so you'll notice that something's missing. So most people with lower level injuries won't really have any issues, but it does not help to just, if you have a spinal cord injury or even if you don't, it does not hurt to take some deep breaths in every once in a while, and that will kind of help you stimulate a cough. Cough is a really strong mechanism for blowing out your lungs and moving anything around in your lungs. And so doing this periodically, I've just as my New Year's resolution, it's been one of the things that I've started to do. I do not have a spinal cord injury, but I just am doing it for general health. And in my little experiment of myself, I think that I have had less colds over this winter by doing it. Whenever our bodies are stagnant, things tend to pool and collect. So if you think about your bladder, and I've written and talked about this several times, when our bladder's just sitting there and not moving, not jiggling around with the action of mobility, urine is just sitting there. And when something's just sitting, it has a higher chance of collecting bacteria. Whereas if things are jiggling around a little bit, there's a lot less chance of bacteria collecting together. Same thing with your lungs. If you're really ventilating and breathing deeply and moving things around, you have less chance of that bacteria and secretions pulling together to create more bacteria. So coughing and deep breathing is something that we can all do, and I just try to do it. I try to do it before and after every meal and before I go to bed 4 times a day. Now, if you have any kind of swallowing problem, you definitely want to do it after you eat because that will help clear your airway and make sure that you don't have anything stuck in your throat that you're maybe not feeling, or that's just like gone down the wrong way, so to speak. So those are very good questions about keeping those airways clear and really moving things out and about. Something that I didn't mention previously is there is a thing that everyone gets in the hospital called the Incentive Spirometer. Everyone gets it. Usually I see it still in the package at discharge because nobody's even opened the package. Nobody's explained to you how to use it or why it's important to use it. But it's a mechanism, it's a little plastic device, and the hospital's extremely expensive because, you know, everything is. So it's a little plastic device. It looks like a little, I don't know, some kind of little chamber, and it has some little balls, and you try to breathe in, and the balls will rise in the little chamber, and then they usually set some threshold. And it's good exercise for your lungs to use that. I insist that all my patients use it because it is such a helpful device. I've had patients who've gone to bed getting a little bit of fever. You hear a little bit of a gurgle. If I'm on the night shift, I'll work with them all night long, every 2 hours, waking them up and having them do their incentive spirometer. And literally by morning, that little gurgle is gone, and they probably averted a pneumonia. Now, they've missed a good night's sleep, but they probably saved a lot by not developing a pneumonia. So that's a device that's very effective, and probably somewhere in your collection of hospital stuff you probably have one. And so using one of those is very beneficial. There are also some lung trainers that runners are using that are available on the internet. Some are pricey, some are not so bad. But if you think that doing some lung training would be helpful to you, there are these devices where, you know, that's resistance for breathing in and resistance for breathing out, which helps expand your lungs and gets air moving around in your lungs. So a lot of people with lower level injury are using some of those just kind of build up their lung volume for general health. The people that are using them, as I say, are athletes that are marathon runners, or people who are running in the 5Ks, or just people who like to jog, to increase their lung capacity so that they're able to run longer and run further and have better exchange, keeping their lungs healthy. It's just something to think about. You can probably do the same, or at least similar, or at least enough lung exercise just by doing a couple of deep breaths and then taking a couple of coughs several times during the day. But if you're really serious about training your lungs, you might want to look into some of those other things. So moving along here, Mason says he has tingling and deals with it with a nerve pill. Yes, there are a lot of commercials on TV for people who have diabetes, who get peripheral neuropathy in their fingers and toes from poor circulation from the diabetes. The diabetes holds sugar in the blood, and the oxygen cannot then exchange over into those places furthest away from the heart, which are your fingers and your toes. And so that's why people with diabetes often tend to have amputations of especially toes, because it's so far from their heart. So people who have neuropathic nerve pain, so most people who have neuropathic nerve pain also have diabetes, but that's only about 85% of the people who have neuropathic nerve pain. So there's another 15% of people who have what we call peripheral neuropathy for some unknown reason, and it can be literally that they have it just because they have it with no other diagnosis, or it can be from a spinal cord injury, which can be from trauma or from a disease process like MS, and taking a pill, the gabapentin or the pre-gabapentin, most commonly known as Neurontin or Lyrica, which are pills to deal with nerve pain. But some of the drugs for mental health also will deal with nerve pain. So sometimes people don't want to take some of the antidepressants because they say, well, I don't have depression, so I don't want to take an antidepressant. But when people take these other pills for mental health, for their neuropathy, they're taking it in like 10 milligrams, 5 milligrams, 15 milligrams, very, very small doses. To treat depression, you might have to take 100 to 150 milligrams, maybe even several times a day. So very, very small doses of these antidepressant drugs can sometimes help also. There is just a paper that came out just within the last couple of weeks talking about how these drugs maybe have been overlooked because people have a stigma about taking them. But they are on formulary, which means that the drug companies have done the due diligence that they can be prescribed for neuropathic pain, for numbness and tingling. So that is another thing that can be used to treat numbness and tingling, but coming from the source, that is another situation. So back to Jenny with her sister with MS. She has her sister who's on warfarin due to a DVT, so she's on a blood thinner. And that shouldn't really affect the numbness and tingling. It could, but there usually isn't a direct effect, so it's probably some kind of peripheral nerve pain, which could be peripheral neuropathy or nerve pain from the MS. So that is what that is all about. So it should be okay with that. Okay. I'm scrolling down again, and so let's talk a little bit more about assisted cough. And I think that was just a suggestion. Okay. Okay. Now somebody else wrote in. I'm trying to read ahead here. Okay. So I was talking about assisted cough with the with an assistant helping you to contract your rib cage. But there's also a device that's available called a cough assist. So now you see how complicated we get because we have two different operations here where we're talking about two different therapies where we're talking about using the same words, assisted cough and a cough assist. There is a device that is on the market called a cough assist, and it's a breathing apparatus that you just use when you need to cough, and it will just help you when you need to cough. And some people are using that device as opposed to suctioning. So if you're able to get one of those devices, sometimes your insurance will pay for it if they see the benefit where you're not going to be using all these suction catheters and all that equipment, and they can replace it with a cough assist. Now, talking about working with Christopher Reeve, he used a cough assist, and that's been widely published. So I feel like I can talk about that. It's not private information, but he used one of those, and he was ventilatory dependent, but he used a cough assist machine that helped him. So if you would like to look into one of those for yourself, as I say, sometimes it's a piece of medical equipment and sometimes your payer will pay for that if it is replacing or if you're failing with the suction for some particular reason. It's a lot more gentle. It's not as harsh as the catheter going down your throat into your lungs, into your esophagus, down into your lungs, and so it's not quite as structurally abrasive as the cough assist is. It's a device that you just wear over your mouth, and it does some pressure changes in your lungs and tends to draw the secretion out. So the next question is, how long should I let a respiratory issue go before I see my physician or healthcare provider, and how can I tell if it's pneumonia? So I think how long you should go really would depend on what type of disability that you have. So if you have if you have a higher level injury, a respiratory situation is going to be a lot more serious for you than somebody who has a lower level injury who gets a cold. So consider your personal situation, and then think about what kinds of problems you're having. If you're having any difficulty breathing, if the secretions are getting away, they're getting so thick that you're having trouble breathing, or you're having trouble removing the secretions, or if you develop any kind of fever, or if your secretions should be clear and basically thin. If they get thick, if they become creamy, or especially if they become green, then you really need to think about talking to your healthcare professional and getting an appointment right away and telling them, especially if you have a fever or if your secretions have turned in a different color, if there's blood in your secretions, or if they've turned green, there's some infection in your secretions are being affected by some infection within your lung. How can you tell if it's pneumonia? Some people claim they can tell if they have pneumonia if they've had it before, and they'll know what it feels like. Really, the only way you can tell if you have a pneumonia is for someone to either listen to your lungs, and in one of your lobes the air is not moving through your lung, or by x-ray. And those are the definitive diagnoses for pneumonia. There are people who will know, there are people who will diagnose pneumonia based on signs and symptoms, and so those are the kinds of things that you need to look for. So for people who hate to go to the doctor every time they get sick, or because they don't want to have antibiotics every time, you know, the more antibiotics we take, the more resistance our body develops to antibiotics. Bacteria want to live inside your body. They require your body to live, and they don't want to be killed. You know, they're trying to survive, you know, by using you as their host. And so every time we take an antibiotic, it affects that bacteria, and that bacteria will mutate into something else so that the antibiotic won't work. That is why you have to, when you're given a prescription for antibiotics, why you have to take the whole prescription of antibiotic to really kill that bacteria that's living in your body. Some people say, well, I feel better, I'll save these for another time. No, because when you stop in the middle of an antibiotic course of treatment, those bacteria have now mutated into something else, and it might take a stronger antibiotic to get rid of those. And the next time it will be a stronger antibiotic, and the next time a stronger one. So that's why you need to take it for the whole time. But people are hesitant to take antibiotics. They try to want to tough it out. And so I think if you just really think about your situation, if you have a higher level of injury, your respiratory system is otherwise compromised, you probably want to go to the doctor sooner. If you have what you feel, you've had a cold before and you feel you've had a cold, that is caused from a virus. It is not going to be able to be treated by antibiotics. Antibiotics only treat bacteria. So some people say, but I take an antibiotic, I had a virus, I took an antibiotic, and I did feel better. Well, it will help those secondary symptoms, but it won't really do anything for the virus. And so when you take an antibiotic, when you have a virus, you're really just developing a resistance to antibiotics by keeping and taking more. So I think I've kind of made that convoluted. So should you ask for a sputum culture? Well, you certainly should if there's a question about if you have a bacteria or if you have a virus, if you have any kind of, again, if you have any kind of different color to your sputum, to the mucus that is coming out, then you can be pretty well assured that you have some kind of bacteria in your body or a virus. Sometimes if you have the sputum culture done, the sputum culture will tell the healthcare professional these are the antibiotics that will kill this particular bacteria in this person. They'll be able to tell if it's a bacteria or a virus. It does cost more, but if you feel like you want to go that route, that is certainly something that I think is important, is to treat just exactly what it is that you have wrong, as opposed to treating with a high-level antibiotic. Antibiotics come in what they call different generation. So the lowest level of antibiotics are things like penicillin, and those antibiotics that have been around for a number of years. So most people who get an infection with a bacteria can be treated with those antibiotics. They're very low level, but they're good soldiers and they do their job inside your body. Now the more resistance that you get to that, or different bacteria have mutated into stronger, their second level bacteria, or their second generation antibiotics, third generation, and now we have fourth generation. But now we're having several bacteria that are coming into the world that are not being able to be treated by the antibiotics that we have created. So there are some companies that are working on designer antibiotics. There are companies that are working on gene mutations into these bacteria, making a gene mutation so that some bacteria can be treated by these. But this is where we're seeing a lot of problems. We hear a lot about the Ezekiel virus that's now in the southern hemisphere, and it's traveling through mosquitoes. These are one of these more advanced bacteria that's that we're having a difficult time treating. So the bacteria is getting smarter, and we're kind of having a struggle to catch up. So I always think avoiding antibiotics is a good thing, but if you have a culture or if you have an infection, you need to take it, and you need to take it for the whole time. Otherwise, you're just going to be consumed by that bacteria, which could make you become septic, which could lead to death. So, we're talking very serious things. It's better to treat a cold than to have it, go into some, treat some bacteria rather than to have it go into a bigger bacteria, or to travel throughout your body and make you septic, which is an infection throughout your whole body. So serious stuff we're really talking about today. I love this about, there's a message here about the abdominal muscles have in fact impacted my singing. Thank you, Steve, because that just points out how important that third piece of the breathing triad is going on there. So without having that abdominal muscle to really force the air up from your diaphragm and force it out of your lungs, it has really impacted singing, so really being able to get that out. There is a cough vest, which is something that people will sometimes use at a higher level. It's kind of like, well, it's a little vest that you put on, and it kind of vibrates, I think is about the best way that I can describe it. And it breaks up those secretions so that they're easier to get out. People will find it's easier to get those funded if you have a higher level spinal cord injury. So when those intercostal muscles are affected, or when the diaphragm's affected, it's not going to do much good if your abdominal muscles are affected, because it's only going to work like a vest, over your rib cage area. And so those can be quite helpful too. They're a little bit, I should say that you can get them if you have a higher level, if you've had multiple respiratory infections. They can be funded, but sometimes it's a little more difficult. Whenever you get into things like the cost assist device or the vest, or if you want to try some of these things, If you can work with your healthcare provider to get a respiratory treatment and try one of these devices out, or if you can work with a company to try a demo device to see how it works for you, working with your healthcare provider to find alternative treatments that might be more comfortable for you or might do a better job for you is an important thing. Then your healthcare provider can provide a letter of medical necessity to your payer outlining the reasons why this would be beneficial to you and why it would improve your general health care. The way insurance works is they only pay for what's in your policy. Now, I could have a Blue Cross Blue Shield policy. I'm just going to use them for an example because everybody's heard of that insurance. You could have a Blue Cross Blue Shield policy, but maybe we have different policies, different information. So having insurance doesn't mean that everything medical is covered. Having insurance is only going to cover what's in your particular policy, the policy that you've signed. So I have a policy that comes through my work, and very disappointing to me, it only gives me 2 weeks of rehabilitation if something would happen. Now, being a rehabilitation nurse, I notice that right away, and I think, gosh, if something really horrible would happen, 2 weeks is not really enough time to rehabilitate. But that is the policy that's available to me through my work, and that is the policy I have, whether I like it or not. So if something would happen that would be really catastrophic, 2 weeks is what my insurance policy would pay, and that would be it. Now there's ways that you can manipulate that, maybe take some funds out of your home health care budget into your rehabilitation policy or nursing home funds if that is covered, but that all has to be done through your case manager who is managing that policy for the insurance company and also managing it for you. Okay, so here is a person who's writing in. They've been a C6 quad for 5 years, and how come I cannot cough just as I used to? It's a light cough, and this person's injured at the C6 level, and that is because right about C5 and C6 is where your phrenic nerve is coming out and going down to your diaphragm. And so when that becomes a little bit injured, just as in the C6, the area is not quite as, the nerve is not as strong as it used to be, nor are the muscles below your spinal cord injury going to respond as well. So it's a combination of all of the things, the phrenic nerve making the diaphragm work, the intercostal muscles in between your ribs, and the abdominal muscles. So if any of those are, several of those parts are weakened, your cough is going to be much more weakened. Let's see. And here's somebody with a ventilator question. A question about his vent setting, and he finds it very low to the ideal setting. Well, I don't know about your particular situation, so I couldn't really say if your vent setting is low or high, but I will say you have this piece of information, so talk to your healthcare professional that's managing your ventilatory settings, because if you think that if you're at a lower setting and you're doing well, then it's probably fine. If you're finding that you're struggling or you're having some sleepiness or you're having some difficulty in concentration or you're having any kind of secondary effects of a ventilatory setting that's too low, be sure and discuss those symptoms with your healthcare professional, because that is going to be the same. That's going to be very important to get the right care for you. So what about sinus cultures? That's a very good question. So we have sputum cultures, which is where you cough up some mucus. or some of the secretions that are down in your lungs, and that's going to really tell you what's going on in your lungs. Sometimes people cough it up. Sometimes they'll use a little suction catheter. Sometimes they use this thing, well, in the hospital we call it a trap. Isn't that an official medical term? But they'll put some suction on one side of it, and so as you cough it, the secretions will end up in this little plastic, it looks like a little plastic cup, and the secretions will end up in there. The difference between a sinus culture is where they will put a little swab or even a tube up your nose and go into your sinuses to culture there. So that's going to find out what's in the sinuses. And your sinus cavities are right at the top of your cheeks on both sides of your nose, right underneath your eyes. So you have two there. And then you have two up behind your forehead, up behind your eyebrows, up behind your forehead bone. There are two sinuses. So you have four sinuses, two sets below the eye and two sets above the eye. And so a sinus culture will tell you if you have an infection up in your sinuses. Okay, so will it tell you if you have a cold versus an infection, really wanting to minimize those medications? And I can certainly understand that. So if a sinus culture will tell you if you have an infection in your sinuses. If you have a cold, it will culture out bacteria. If you have a virus, it will culture out more like the flu, is more of a virus kind of illness. And so it will tell you if you have a bacteria, or some of them can tell you if you have a virus. So finding out if you have a bacteria, which the cultures will tell you, that's what they are particularly for, is for bacteria. So if you don't have any bacteria that grow out in the culture, then it would assume it's some kind of virus. It's kind of, a diagnosis by exclusion kind of thing. So sometimes people want to go on medication right away. They have the culture done and they'll be started on one particular kind of antibiotic. But if it turns out that it's a virus, your healthcare professional might call you and say, stop taking that because you don't have a bacteria, so it can't mutate into something else. Or they might prescribe some of the medication like Tamiflu, you see that on TV, that will help decrease the symptoms and the length of time that you have the flu or a virus. But now not everybody can take Tamiflu, so don't go just expecting you're going to get it. Some people will want to wait a while if their symptoms are not too bad, but they feel like they have some kind of bacteria, a cold, they feel like they have something, they might choose to wait. And again, these are individual decisions based on how you're feeling at that particular time. It takes 3 days to fully grow out a culture to see what exactly it is that's growing and what bacteria it is, and to determine which antibiotic is going to treat that bacteria. So if your symptoms are mild and you get a culture and you decide, I think I can wait and I'll just wait to see what it is, or I don't want to take that extra bacteria. But if your symptoms are really bad and it's affecting your breathing or it's affecting your function in some way, you might want to go ahead and start on an antibiotic right away. Here's a question about bladder spasms. So this person has tried bladder medications for overactive bladder, and they've tried Botox injections, which helps with bladder spasms, and now it's being suggested that he tries augmentation surgery. And how have patients done with this? Well, patients who need the surgery have actually done very well with the surgery. Surgery for anyone is very risky. I think we all as a society take surgery way too lightly. There are a lot of risks with surgery. It's not so much the surgical procedure, but you've probably heard a lot. It's the anesthesia that you're taking that affects your breathing and your ability to start breathing again when you are stopped taking the anesthesia. And so there's a lot of consequences of surgery. So it's really something to think seriously about no matter what kind of surgery that you're having. So if you find that you think your physician is recommending augmentation surgery and you think that that might be a good step for you, you certainly have done your due diligence with the medications and the Botox injections. It sounds like maybe you're a little hesitant for running into having that surgery done right away. It's not something that you have to have done like this afternoon. You have time to think about it. It's not an emergency surgery, so you have time to think about it. Talk with your doctor about the risk and benefits to you, the risk of surgery to you. You have, it seems to me like, you mentioned your level of injury. So talk to the surgeon about that and what the benefits will be to you. And then, carefully decide. Talk to the surgeon, what if you don't have the surgery? It's a great idea to talk to your rehab physician or your rehab professional about the surgery in addition to the surgeons. Remember, surgeons are going to be very pro-surgery, and your rehab physician might be able to give you a little bit of different opinion about the surgery, the risk in relationship to your injury. Now, I'm not saying that the surgeon will not give you all this information, but having that second opinion, if you're not quite sure if you should do a surgery or if you shouldn't, be sure and talk to somebody else to see what the risk and benefits are to you. And then also remember at the Christopher Reeve Paralysis Foundation, there is a peer support group. So there is a whole cadre of individuals who they can connect you with who have had bladder augmentation surgery or perhaps have decided not to have it, and they can give you their reasons. Now remember, those are their decisions, and you have to make your own decision. But if you have questions about other people, I'd like to talk to somebody who's had the surgery who's in my condition. So ask your urologist if he has another patient that would be willing to talk to you, which is always nice because it's the same doctor, so they can kind of give you the information about the process in that facility with that surgeon and how the whole process went. But also at the foundation, there are peer mentors that can tell you, I had this surgery and this is what it did for me. So if you're not quite sure if you want to have a surgery of any type, be sure and do your due diligence and get as much information as you have. Just because you talk with somebody and they give you their opinion doesn't mean you have to do the exact same thing that they do, because that was their situation and you are in your situation. But it's another resource that you might not want to overlook. Another comment is that people often forget that a sinus infection is part of an upper respiratory infection. And so that is exactly true. And sometimes when you have those sinus infections, your first symptom for that would be a sore throat, because what happens is the sinuses want to clear out. Sometimes they're swollen and they can't clear out what's in their sinuses, so it backs up and drips down in the back of your throat, and that dripping of that mucus into the back of your throat makes your throat raw. So anyway, I'm going to go ahead and stop there because time is up, but this hour has just whizzed by for me. So I will swing it back to Julie, and if you have any further questions or thoughts, please don't hesitate to write in to the blog. We're around answering your questions, and there's a variety of resources at the organization that would be very happy to assist you in all sorts of issues and quandaries.
Thanks, Linda. Yes, please grab a big tall glass of water. Thank you for your time, everyone that joined us. for this wonderful hour and a little bit more than an hour talking with Nurse Linda. And thank you all for chiming in with your questions, because it really helps to keep things going and moving along and making sure Linda's talking about things that are interest of you. So this is being recorded, and you can view this presentation at the end of the week at christopherreeve.org/webchat, and also look for the next chat live with Nurse Linda at the end of next month. And you can look on christopherreeve.org's homepage and the event listing for that. So thank you, everybody, and have a great rest of your day.